The whole house was crying. Everybody was so excited. We were hugging and we were embracing. I think it was like 7 in the morning, and in our little neighborhood, I think we woke up our neighbors. It was very emotional, very emotional. So
Oh, wow. So what was this like for you, seeing him kind of go through this journey with us? And um, do you feel like he made the right decision? All right. So next we've got Jalen. So Jalen, I hear he's here today, and he's going to tell us about his experience. All right. So Jalen, let's see if you're here. Jalen, are you there? There you
Yes,
are. How
sir.
you doing, my man?
I'm doing all right. I'm doing
All
all right.
right. So,
Relieved.
well, first of all, congratulations on being a brand new fire medic. Just so proud of you. And I want to get your experience of what was it like, if you will, just kind of bring us up to speed on what was your journey. So tell us kind of what happened before you came into our world, and then what happened after you came into our world, different resources that worked best for you, how this program kind of made a difference. And I just kind of want you to take it from there.
Gotcha. All right. Well, before I joined the program, after school, my school, they teach you kind of, how they teach you about the test. They kind of teach you, as much as possible about the test, but they don't really prepare you for the test. You know what I'm saying? Um, some
Hmm.
people, they may pass it on their first try, their second try, they may come out and just pass it immediately. But what about the people that don't pass it off the bat like that? You know, they
Okay.
they kind of they kind of left out there to dry, left out hanging to dry. So
Mm.
that's kind of how I was. I was trying to, I kept, using programs. I kept using, just trying to find different testing examples to, continuously take exams to, get myself familiar with questions because that's all I really could do. But at the same time, I kind of was, kind of felt like a revolving door. I didn't know where else to go, to be honest with you.
And what was it? So, what was it about the other programs um, that made it difficult for the information to just connect? Was it that you didn't have anybody to talk to, or it was just an app with questions, or where was the disconnect?
It wasn't no interactiveness. It was just questions. It was just apps with questions. It's just
Okay,
yeah, it wasn't I didn't feel like a god. Like I
okay,
felt like a god once I got into this program. Now I did have somebody from my department that I knew for a while. She was helping me
hmm,
with the tests and stuff like that. It's Miss Kelly.
oh
She
yeah,
I,
yeah,
she
okay,
actually joined the program. She pointed me. I wanted to get to that, but she was helping me with the exam, and I guess she ran across your information
mm,
and she pointed me in the direction of you, and that's how I got to you.
hmm.
Um,
Oh,
I'll say, yeah, go ahead. You go.
so how many times had you failed the exam prior to coming to Level Up Medic?
I failed it for three times.
Okay. And do you remember what your scores were, or the range of scores?
Yeah, so my highest score was a 880. That
Okay.
was the highest I've got, and that was on my fourth attempt. I think on my fourth attempt.
Okay. And then so if you can kind of quantify it this way, what was the biggest thing that you were struggling with? Was it the not knowing the information, not knowing how to do the questions? Where were you struggling before the program?
Well, it was a couple reasons, but one thing that I continue to say because I got people, as you know, people are continuously texting me trying to
Mhm.
figure out what they can do to pass.
Okay.
And one of the main things I tell them is test take, like actually knowing how to take a test, like actually
Mm.
knowing how to break a question down.
Mhm.
So, because before I would just I would read like you say like a stock not a stock auctioneer,
Auctioneer, yeah.
just read just do that
Right.
and I would do it, but I kind of like I wasn't confident with answering the question because I couldn't really break it down. You know what I'm saying? And
Mhm.
then when I would get the questions that's like a little difficult, I'm definitely stuck now because I can't
Okay.
even break down the basic ones, you know.
Okay.
So I think that was like the biggest thing because I felt like I was pretty good with the information that I learned from school.
Hmm.
Maybe need to attack a few more points, but I thought I was pretty good with the information. You know, as you as you stay out of school for long and you don't pass, you tend to forget some of the information.
Sure.
But
Sure.
information wise, I was solid. I just didn't I wasn't a strong point wasn't me knowing how to break a question down in test taking.
Okay. Okay, so fast forward to the point where you said, so Miss Kelly from your job, she kind of,
Hmm.
she found out about us some kind of way, and then she
Hmm.
pointed you to us. All right, so I remember. So refresh me on the story, because at some point you and I ended up talking.
Hmm. Yeah, so when it was after, I think it was after my fourth attempt,
Hmm.
and we were talking about how we were talking about the exam, me and her, and we were talking about the exam. I told her like, I'm gonna just take a week off. I'm trying to figure out, because it was a lot, after you fail an exam of that magnitude, it can weigh on you. So I took some time off, and I'll say like the next Monday, that's when she sent the text. She sent the text message of one of your videos. She sent a text message of one of your videos, and after that, she kind of told me about you, and I watched a couple of them, and I was intrigued. I was intrigued. If I'm gonna be
Okay,
honest,
and what was it?
I
What
was
did you?
more intrigued.
Okay,
Oh, go
go
ahead.
ahead.
I was gonna say I was more intrigued seeing somebody that kind of resembles me.
Sure.
I was that made it even more intriguing.
Okay, got
But
you.
when I seen you, like you were able to break questions down, which is what I was looking for, break them down into a sense that I can understand. I was like,
Mm,
okay, I think I'm gonna try this. I think I'm gonna
okay.
try this. Now, as far as I had to get my mom on board too, because it was, like all people that join, it's a steep price. It's a steep
Sure.
price. But my thing was, I bought all these shoes and clothes and all this extra stuff. Why not invest in something that's gonna help me with my future?
Sure.
Something that
And
I
it's
that I
not so much that it's a steep price. It's just probably like if you're comparing it to just test prep, sure, the investment is more than like a test prep program where you don't have a
Mhm.
coach. But if if you're comparing it to actual coaching, it's actually far less than like if you were to hire me to sit down with you for all the hours that I'm going to be with you in the program, you would pay way, way more. Um,
Mhm.
and as I tell you guys all the time, it's not that I'm not just teaching you to pass the test. I'm teaching you how to think and how to be a much better provider. Would you say that was the case now that you've gone through the program?
Man, definitely,
Okay.
definitely. I think things through way more than I did before the exam, like
Okay.
way more.
So
I learned that. Yeah,
you were telling me about so you said that you had to get it through, you had to bypass your mom,
yeah.
run it by your mom. I remember that day. So I remember there was a day, I don't know, did you reach out to me or how did you find out about me? So Miss Kelly told you about me, and then what happened after then?
I DM'd you on Messenger,
Oh, got you. Got you.
and yeah, I DM'd you on Messenger, and we got on the phone
Okay.
through Messenger, and then my mom was also on the phone through Messenger, and
Okay.
that's how we continued to talk to each
And I
other. So,
remember, so you and your mom had questions. I actually spoke to both of you, and I said, "Oh, your mom's there. Just put her on the phone." I'm
mhm.
not saying I'm a mama's boy,
Yeah,
but
yeah,
I know how to deal with moms. And so
yeah.
I said, "Put her on the phone." And I said, "Okay, mom, what questions do you have?" And I remember, well, I don't even really think that she was skeptical. She just had questions, especially after you had gone through multiple programs. Her question is, okay, is this going
Mhm.
to work finally,
Mhm.
right?
Mhm.
And I remember telling her, hey, mom, I'm going to do my part. I promise you, I'm going to do everything in my power to help him pass the exam. He just has to do his part, right?
Mhm.
And so, anyway, you guys decided to go ahead and invest in the program. You decided to take action, and you got enrolled. I believe you came in cohort 3. Is that correct?
Yep.
Okay.
Mhm.
All right. So you get into the program and then take us from there. So what was your experience like? Um, what resources did you find most helpful and that kind of thing?
Mhm. Uh, the whole community is beautiful. I'm gonna be honest with you. Um, I try my best to use every resource that you
Okay.
put out, from bonus to comprehensive study guide to the drawings to
Okay.
anything that I thought would be a help to me. I try to use. Um, I would say I would say that the drawings and that 21-day challenge,
Okay.
something about that it kept me glued. It just kept me
Mm,
glued to learning and to preparing myself for the test.
okay.
Um, those rapid drills, like constantly doing those rapid drills, those questions after we would watch the videos,
Uh-huh.
and all that information just combined, and knowing that in order for you to know that you completed, you had to type in accomplished under the
Sure.
things. It just was like something that just kept me in my head. It's like, okay, you got something you got to complete. You
Okay.
got to do this. You know what I'm saying? And although it maybe felt like a task, it felt like, I'm gonna be honest, you made it enjoyable. I don't know
Mm,
how, but you made like learning enjoyable for me, and that's been something for me. Like if it's something that's enjoyable for me, I'll be more in tune to it. I'll be more in interactive. You know what I'm saying?
sure.
So.
Sure. And that's the thing that you guys have heard me talk about my mentor, Dr. Francis. When so after studying medicine and I was studying for my first board exam for medicine. I remember when I met Dr. Francis, he just, the way he would, the same stuff that I'm doing for you all, that's what Dr.
Mhm,
Francis did for me. He drilled us every day.
mhm,
He would draw pictures for us, and so I'm very similar in my mentor. But I remember the very first day I was in his program, I remember calling my mom and I said, "Mom, I don't know who this guy is, but I'm so excited to learn again," because he was
mhm,
connecting the dots. He wasn't just reading PowerPoints and just giving me like a bunch of information. He was showing me how all this information connected. And it was like for the first time in my life, it was like walking into a room and I could see clearly now. Whereas
mhm,
before, it was like I was always walking into a dark room, a very dimly lit room. But suddenly with him, I was seeing things that I never knew. I was making connections that I didn't even know were patterns. And that became fun. So you use several resources now in all transparency. So you actually came into our program, but you were not successful immediately after, which is kind of
mhm,
abnormal. Most people do pass their next attempt, but for whatever reason it didn't work out. But I told you that I'm still here. I'm still going to support you. And you got back in, you kind of reset and kind of went back through the 21-day game plan. And what was the difference? So for attempt, I believe number 5 for you versus 6. What changed for you between those two attempts?
It was confidence. It was confidence, and it was confidence due to me putting the work in.
Okay.
So on my fifth attempt, like obviously I did, what we were supposed I did what we were supposed to do as far as the program, but for some reason, like my confidence still wasn't there. And I
Okay.
couldn't I couldn't figure out why. I didn't know. And I had some test anxiety, and you actually helped with that too.
Hmm.
Um, but after I did that on my sixth attempt, I went into the testing room smiling and came out smiling.
Okay.
So I can't really explain what it was, but whatever it was, like probably that anaphylaxis teaching video was like
Okay.
it clicked. Like something
Oh wow.
clicked in me that day, and it was like from that point on, any of the practice exams that I did, I was knocking them out like it was nothing. Like no, I felt like there was no question that I couldn't take a handle. I couldn't
Wow.
answer. Like
Wow.
I didn't really feel challenged. And even when I did feel challenged, I knew I had like a guideline or a plan I could fall back on if the question felt like a little
Sure.
challenging. Like for instance, I remember it now. For instance, I had a question about myasthenia gravis,
Yeah. Yeah.
and I looked it up. I looked it up after the exam,
Okay.
but some key things that I seen in the question, well, they said something about respiratory difficulty breathing, but they said he wasn't having his chest wall wasn't moving. His
Aha.
chest wall wasn't moving.
Aha.
So I immediately clicked, oh, this is a ventilation.
That's a ventilation
The
problem, of
ventilation.
course.
I knew it off the rip. I knew it off the rip, and that's when like I had like these moments on the test, which was crazy. I had them on the test, and I just knew at that point I was like, man, they can throw whatever they want at me.
Okay, and I
It's not
gotta
gonna matter.
interrupt because this is so cool.
Yeah,
Because that's exactly what I've told you guys, that it's not so much that you know everything, it's that what you need to know what to
yes,
do when you don't know everything.
yes.
In
Because
this
I did,
case, you
yeah.
said that you didn't really understand myasthenia gravis, you didn't really know it at that point, but you still had a framework, you still had a pattern to work from. In that case, you were working from the OVP triangle, that I
Mhm,
say everything comes down to oxygenation, ventilation, or perfusion. In that
mhm,
case, you were able to figure out that, oh, this is a ventilation problem. I'm going to fix
mhm,
that with a BVM plus
mhm,
oxygen plus airway adjunct, right? So
mhm,
the
mhm.
patterns worked. And,
Yeah.
but that's how it is in real life, that you don't always know everything. You're not going to always know what's going on with your patient, but you still need to know, okay, what do I need to do about it? Like, what do I need to do in the time that I'm going to be with you until we get you to the hospital or until somebody else with higher level of care takes over? What do I do for you?
Mhm,
And when you have that information, that kind of OVP triangle, that kind of thing, when you have those frameworks, it makes it easier to pass any test, and it makes it so much easier to take care of real patients. I
mhm,
remember we did a Q&A session uh, recently, a few days before your exam, or a couple weeks or a week or two before your exam. And I don't know what happened, but because I saw you throughout the program, and I remember your day one.
mhm,
Like if you go back and look at some of those previous videos earlier in the cohort or in the training, there were some times where I'd pop you in the box and I'd say, "All right, Jalen, let's answer this," and you were not able to answer it as well. But
mhm,
we got to that Q&A session, and so I had gone through a few students at that point, and then you were the next student up. And I said, "All right, next up, we've got Jalen. Let's pop you in the box." I put you in, and we went through multiple questions. I remember we got to this part on anaphylaxis,
yeah.
and I said, I was like, "All right, so the question was a scenario about anaphylaxis and an anaphylactic reaction." I said, "All right, well, go ahead and explain the pathophysiology of anaphylaxis." And I remember you said, "You want me to go to the beginning, like
Yeah.
sensitization?" I said, "Yeah, show off." But I remember the way you were answering questions, like going back to that you even started talking about the IgE and the IgE cross-linking and how it activates the it's made by the B cells and it activates the mast cells, causes the release of histamine and leukotriene. And when you just said all this, I was like, whoa, this is amazing. How did that
Yeah.
make you feel?
I knew like, oh, I'm ready. I'm ready now. I'm ready. I know maybe gotta, I'm gonna finish the challenge and I'm gonna finish, the things the tasks that I still gotta do. But at that point I knew, oh yeah, I think I'm ready. I think I'm ready. I put in enough work because like you say in the beginning, I was a little unsure of myself,
Okay.
when it came to answering some questions and you would call me up. But like as time went on and after that last attempt, and I came to this point where you called me up in that
Yes.
Q&A and I was
Mhm.
able to answer like that. I knew, yeah, I put in enough work and I was ready. I was
Did
ready
you
for
feel
whatever they threw at
different?
me. Oh yes, like I told you, I went into the exam smiling and I left out smiling. So I just knew in my head that, oh yeah, I got this. I got
Wow.
this.
Wow.
Yeah.
I was
I
so
got
impressed.
one more thing.
Sure.
I know. I got one more thing. So I had another question because I remember it said it was talking about an elderly female and a diabetic.
Mm.
And one of they gave them symptoms, but she didn't have the chest pain. And I knew, well, when it comes to the elderly female diabetic, the nerve endings, they can't feel pain.
Okay.
So it was crazy how I was just having these visuals happening to me at the test.
Wow.
So I was looking at the answers and I seen aspirin and nitro. I said, that's it. That's it right there. That's it right there. I knew it
The
immediately.
atypical chest pain. Yeah. Or
Yep, I
atypical
knew it
chest breathing. Yes,
immediately.
right.
I knew it immediately. So yeah. Yep.
Wow, that's impressive. Like your story
Yeah.
about the myasthenia gravis, that's
Yeah.
an exact example of what I've been saying all along. That it's not so
Yeah.
much that you know everything; it's that you know what to do when you don't know everything. So
Mhm.
for somebody who's considering joining us in the 14 days program, or doing the 21-day game plan with us through Level Up Medic, what would you tell them?
What I would tell them is, ooh, that's a good one. Put the work in. Put the work in. Ask him as many questions as possible. Be very interactive in the live sessions. Be very interactive with when it comes to trying to figure out things that you don't know. Challenge yourself. Do drills with drill partners. Make sure that when the information that you are getting from the program, that you I wouldn't say, well, no, I'll say that. I'll say you maximize it and you master it. That's what I want to say. You master it, because that's really as how I feel. I feel like I've mastered a couple things. Now, obviously, there's levels to it, but the way I just told you those questions, like it seemed like I kind of like I mastered it, and I went in there. I went into the exam with 100% as far as confidence. So really really taking your time with the program, going and using having a lot of confidence and asking a lot of questions and using the material. Like there's these resources, you have these resources for a reason. It's for us to help. It's for us to better prepare us for the exam. So yeah.
Okay. And I would agree. I would absolutely agree with that. Is there any reason that you would tell somebody not to do this?
Nah, I wouldn't. I mean, unless you pass it on your first try. I mean,
Okay. But even then, because there's a difference in somebody who passes at a 950 and a
and
3000 level medic.
mhm,
There's a
mhm,
they're totally different providers. But Jalen,
mhm,
I just want you to know how proud I am of you. I remember I actually talked to Kelly about you, and I
mhm,
remember just seeing the transformation of where you were at the beginning compared to when I saw you on that Q&A session. I
mhm,
saw a totally different person. Like, not just in terms of somebody learning more information, but truly understanding it, like really owning the information. So I just want to say, as your coach, it was an honor being able to serve you. I hope you'll stay in the community with me. But I want to shift gears just a little, because what I want you to know is it you mentioned something. You mentioned how one of the things that made you choose my particular program is when you looked at all the other providers and other resources out there, you had not seen anybody that looked like you, right? And so I represented something different for you. The other thing, though, is what I want you to know is you've now started the process of mastering information. You have the ability to learn. You're a really smart guy. And what I want you to know is, yes, I'm proud of you for being a fire medic. And that's a level that so many people aspire to. And you've gotten there. And you should be proud of yourself for hitting that level. But I don't want you to stop there. Okay. You have what it takes, Jalen, to, if you decide, I want to go on to nursing, I want to be a nurse practitioner, I want to go on to medical school. There is no reason that you, Jalen, can't be Dr. Borders.
yep,
Okay. And so I want you to just right now, yes, you've got to go through your onboarding and your FTO process at your job, at your department. And yes, that's going to take a little time. And that's where your priority needs to be for now. But I want you to just keep it in the back of your head that you can go on to be a doctor. There are so many people that you will be able to impact. There are people who need to see you not as their fire medic, because as their fire medic, you're going to be able to make a difference. You're going to be able to serve people in a way, you're going to be able to reach people in your community that other people that don't look like you may not have the same impact. Okay.
mhm,
You will be able to make an impact at that level, but you yourself will be able to make a much greater impact, especially at the doctorate level. So I want you to consider that. If you need help navigating that journey, I'm here to help you. As someone who's navigated that same journey myself, I can definitely kind of help you avoid some of the pitfalls and that kind of thing. But I want you to just keep that in the back of your mind that one day I could be Dr. Borders.
Yeah.
Okay. You have what it takes. And I just want you to know I'm so proud of you. You made us all proud.
I appreciate that. I appreciate that. I actually got a surprise for you.
Hmm. Okay.
Hello.
They can't see.
Hey.
Hi, how are you? I'm
Hey,
sorry. I just came
is
from
this
my
mom?
workout.
Is this mom?
Yes.
Hey, mom, how are you? Wow.
I'm good. I'm good. I'm good. I'm very happy. Very happy.
Wow. Well, I know you're proud of him.
I am. I am very proud of him. When we found out, was it Thursday morning? The whole house was crying. Everybody was so excited. We were hugging and we were embracing. I think it was like 7 in the morning, and in our little neighborhood, I think we woke up our neighbors. It was very emotional, very emotional. So
Oh, wow. So what was this like for you, seeing him kind of go through this journey with us? And um, do you feel like he made the right decision?
yeah, I definitely feel like he made the right decision. In general, just with the career choice. Am I coming? Okay, I'm sorry. With the career choice and also with your services. Um, I saw him like focusing in as far as like trying to master the information as well as trying to prove to himself that he could do it. We both struggle with anxiety. I recently passed my NP boards back in September.
Wow,
So
congrats.
yeah, thank you. So seeing him master that made me feel better because I could relate to him on how he was feeling, how he knew the information but didn't know how to bring that through, apply that when he took his test. So that was very emotional and it felt like a win, not just for him, but for me too.
Wow, wow.
Yeah.
Well, it is so good to meet you.
Same
I
here, same here, same
I
here.
remember we talked on the phone, and what made you what made you kind of give him that push to just, yeah, go ahead, and this is the program for you?
I think the conversation that we had with you,
Mhm,
when we first started, I think I said, I just want him to pass his boards. And you was
mhm,
like, okay, I'm okay with him passing his boards, but I want him to fully understand the information and I want him to be the best paramedic that he could be.
mm,
You were saying what is it? Just average was not good enough. That you were
sure,
thinking that needs to make sure he understands the information because he's going to be taking care of people.
absolutely.
So in that case, he needs to master or at least have a good understanding of the information. So after you said that, I thought about my response versus your response. And I said, okay, I think he cares enough that he wants to make
Mm.
sure he grasps all the information.
Oh, wow, wow. Well,
Yeah,
thank you so
no
much,
problem.
and
No
it's
problem.
a pleasure meeting you. It was thanks for letting me have him for a little bit. Um, I don't know if he told you, but just when I saw the transformation of your son and how he grew as a provider, as in his knowledge base, it was beautiful to see. The way he was answering questions in that last Q&A was just you would have been proud.
I heard about it, so I'm over ecstatic for him.
Yeah, you should show her the video.
I will. I'll send it
Okay.
to
Okay.
her. Yeah.
Well, did you all have anything else? It was thank you for taking this moment with me today, and thank you for all that you've done in the community. And so, what I ask you to do, Jalen, is continue showing up. Now is where the real learning starts. Yes, you've passed and all of that, but you've got to be getting better every single day because you never know what patient you're going to be called to serve, and they don't get a choice. They don't say, "Oh, I have chest pain and will you send me the best?" They just say, "I have this problem." And sometimes it's the luck of the draw. Sometimes the person that shows up is not good. And so I want whenever you show up, that patient gets the best possible chance of survival. Everything's not within your control. Sometimes God has other plans. But if it is in their plans for them to make it, I want them to have the best possible chance. And with you, I feel they will. So it's been an honor. I ask that you just stay engaged with us. If there are other things that you want to continue learning, by all means, reach out, stay as active as possible. And I also want you to kind of think about the people who are coming behind you. And to the extent that you're able to help any of them become better, do that.
Yes, sir.
Okay. All right. Anything else from either one of you?
No, I'm good.
Okay. Well, Mom, it was so good to meet you, and we're all so proud of you. Jalen, it's been an honor being able to serve as your coach.
Yes, sir, Coach. Thank you for everything.
You are certainly welcome, sir. And keep what I said in mind about I want you to go higher.
Mhm.
Like you have what it takes to be able to go to much higher levels. Like
I got you.
paramedic is great, and it's a level like a lot of people want to get there. But if you want to go to flight, if you want to, especially if you want to stay in the healthcare arena, um, definitely keep working on becoming better, because it's going to open up so many more doors for you.
Okay.
Okay. But I'm
Yes,
proud
sir.
of
I
you,
got
my
you.
man.
Yes, sir.
All right. Well, thank you so much. And you have an amazing day.
You too, Coach.
Okay.